Welcome, everybody. This is it.
This was really mission-oriented nonprofit work. I mean, it was everybody focusing on what the job was and then offering what they could do to make it come about.
Probably back in October or November, we had some conversation about when the vaccine comes, what will it look like? Lauren sent an email to Mark, who owns Bainbridge Island Community Pharmacy, and asked, hey, would you want to partner whenever that vaccine comes to the island?
I said, hey Mark, I have no idea if you are going to be a vaccine provider in the county, but if you are, and if you need help from us, we would love to assist you.
And I think I replied to him like right away. I said, hey, yeah, if I need anything, yeah, I'll let you know. A week after that, I received an email from the state telling us in 2 days you'll receive 300 doses of the Moderna vaccine. And they want us to administer those doses within the week.
I saw Mark's call come in on basically the week before Christmas. I was like, oh, I better answer this. And Mark essentially was saying, Lauren, remember that help that you suggested you might have?
We're kind of in a panic then because you see our small space here. It's impossible to accommodate that number of people.
Where do we have the space? Where do we have the room logistically to support such an effort? And that's where we started with some space at Winslow Green that was offered to us for free.
And so we turned it into a clinic, had to print out all, we were basically just, again, figuring things out, every minute. It was like, oh, what sort of, consent forms do we need? What sort of, CDC materials do we need to offer?
Started vaccinating healthcare professionals at around 1 p.m. We received the vaccines from UPS at 12:30, so in that half hour, we thawed out the first 100 vaccines, brought it to the venue, and yeah, we vaccinated 100 people in 6 hours.
And from there was this running joke of, let's give out Anne's cell phone number, and that's how people are gonna sign up for a vaccine. And that's really what it was for those first couple weeks. It was email Anne, we get on the list, we make your appointments, and we put together our first couple clinics that way. And then of course we soon learned it was much bigger than that. And then we shifted to the senior center.
And so we offered this space because it was empty. We weren't doing any programs here. And we had worked with Lauren Bast and Ann Lesage before, so that made it easy to get the conversation going.
Every step along the way, we kept adding more and more partners. The senior center, island volunteer caregivers became very integral to reach the most vulnerable population, individuals who wouldn't be able to sign up for appointments online, who maybe needed transportation assistance to get to their appointment.
It kind of came out of the blue, actually. On January 1st, we received an email from Lauren Bast at Bainbridge Prepares saying, listen, the vaccine is coming to Bainbridge and we think that IVC would like to be involved. Do you have some volunteers who might want to help out in the vaccine effort? And if you remember back to where we were in January, it was like, yes, of course.
The first clinic was definitely sort of a seat of the pants affair. We were trying to figure out how to organize ourselves. I think we had one person in the lobby who was going to do the check-ins and get all the forms filled out and direct people to the place to get their shots. So it was overwhelming, but we managed to, get shots in arms, which was the key thing that we were trying to do. We were working from the start with island volunteer caregivers very closely.
Everything from really, the welcoming to the post-vaccine monitoring. The only thing we didn't do was give the shots.
Every time we had a clinic, it got more organized.
We realized that we needed to have not just a registrar, but we needed a door greeter, and we needed someone to help them with forms and someone to take them back to the vaccinators. And those 4 jobs I did all by myself at first. and with computers that weren't running really fast. So I was trying to register people and answer questions and whatever. And we just kept getting better and better.
As all of this was evolving, we were going from 50 doses a day, 100 doses a day, 150 doses a day, and then I think at our peak at the senior center, one day we did over 200. And that's where we shifted gears towards a more formal planning effort. Come up with our staffing model, our volunteer ratio, scheduling, logistics. Let's get a written plan in place so that if we're going to do something that's a high throughput clinic, we have a plan that supports that. And one of the things that we did not want to happen was solely serve Bainbridge Island.
There was a number of shut-ins that were in Bainbridge Island and even in the rest of Kitsap County and Mason County. Those people couldn't get out for one reason or another.
I would say we probably did over 200 people on these mobile visits, the mobile clinics. Sometimes we would have 7 to 11 people in one day. That's all we could get to because of all the driving in between. And sometimes we would go to a site where they had a mobile trailer home, for instance, where they had 20 people gathered in the community center, and then maybe we had 2, 3, 4 different homes that the people were so immobile they couldn't even get to the community center.
As we were doing clinics of 100 people a day or 200 people a day, the senior center was the right size to essentially allow that throughput through.
We realized if we were going to expand and try to get thousands of people through, we needed something bigger.
We did an outdoor clinic at Woodward in the middle of winter, and we found that that was kind of cold. No matter how many space heaters we had around, we really wanted an indoor space to get us through the end of winter and the spring. The school district made the Commodore gym available to us, and so we, within a week, switched, moved all of our stuff from Woodward to Commodore, again with the help of all of our volunteers.
And by the time we got to Commodore High School, where we were doing over 1,000 people a day, they had it down so smooth you would never know how much work it was taking to get it all to work.
Did anybody look at the county health district webpage, vaccine demographics stats that came out on Wednesday? Bainbridge Island, 12 and olders, 75.8%. And that's because of all of you doing this. So, as I've said from the get-go, what we're doing here is we're saving lives. And everybody that's involved today, regardless if you're outside, inside, if you're doing registration, if you're doing post-vax, everybody's got a part of that. So kudos to all of you for spending your time doing that today.
We realized this was not going to be a one-week thing, this was going to be a several-week thing. We had to take care of our volunteers, and we needed to make sure that when they came in, they felt appreciated, and the refreshments were a big part of that. And so we've got coffee donated, there's food that's been donated by restaurants on the island. I wanted to get involved, and it started out with one day, and then the next day, and the next day, and it's been weeks and weeks now. And it's been one of the most amazing things I've ever done in my life, honestly. And it's given me back what I think I lost during COVID. I feel so much more connected with my community as well. That's another just connection that's happened for me. And I think the people that I've met here and the relationships I've formed here are going to be lifelong. And I think the impact of this, of what we've done here, is going to ripple over time.